Hello and welcome to the Calisthenics YouTube channel. Today we start our new physio series. Well, it's me talking. Every tip, exercise and piece of advice here has been created by our physiotherapist and coach David, based on tried and true physiotherapy practices. So, unlike general fitness or calisthenics tips, you're getting solid, professional physiotherapy guidance. Today, we're discussing some injuries many athletes face during their training journey. Specifically, we'll cover one of the three most common dip-related injuries, sternum pain. We will break down each injury, how to prevent it, and effective strategies for those already dealing with these issues. We will also show you an example of how a rehab plan could look like. By the end of the video, you'll understand why these injuries occur, how to prevent them, and what to do if you're already experiencing discomfort. We will also look at some rehab exercises to help you regain your strength. Why do these injuries happen? Dips are an incredibly effective exercise for building upper body strength, targeting the chest, tricep, and shoulders, which makes them a staple in many strength training routines. Dips hold a special place in the world of calisthenics, where they are often featured in 1-rep max or endurance competition. A lot of beginners start with dips as soon as push-ups have become too easy. If you have followed our channel here and on Instagram for a while now, you will know that we aren't particularly keen on this exercise, especially for beginners or as an assistance exercise for skills like the planche. That being said, dips, as every multi-joint exercise with loading possibility, comes with risks when loaded too quickly or trained too frequently, especially with bad form. So, what is considered good form in a dip? The choice of form will depend on your goals. Covering the dip in every detail would take too long, so we will just give you general recommendations here. We like to differ between three dip techniques. The bodybuilding dip: slightly open to neutral chest, scapulas slightly depressed, big stretch at the bottom, mostly upright position, chest looking forward. The closed dip, very often seen in German streetlifting competitions. Slight protraction, strong depression in the shoulder blades, lots of tension in the lats. Slight crunch in the core, strong forward lean. Chest looking about 45 degrees down. The hybrid dip, a mix of the two, very often seen in Italian, French, and Spanish athletes. Neutral to very slightly closed chest, depression in shoulder blades while making sure they can still move freely. Tension through the lats and trapezius transversus. Slight forward lean plus push forward of the chest, obliques engaged, body stacked. We can discuss all the advantages and disadvantages in a future video. Let us know if you want to see that. The right choice is usually based on individual goals of the athlete, anatomy, and mobility, plus comfort. So now that we have covered that, let's finally talk about the most common injuries. Sternum pain in dips. One of the most common issues with dips we see is sternum pain or costochondritis. The cause for this pain is usually the excessive stress placed on the chest in an extreme position, such at the bottom of a heavily loaded exercise like the dip or the bench press. The tricky thing about this pain is that it can be caused by excessive stretching of the structure as well as through excessive compression. To better understand this, let's take a look at the sternum anatomy. The cartilage around the sternum has limited blood flow and is less tolerant to stress than other structures. The close proximity to the pectoralis muscle means the pecs can transmit excess force onto the sternum cartilage. Cartilage can adapt to stress, but unlike other tissues, it requires gradual conditioning over an extended period of time. This is partly because the cartilage has little to no direct blood supply, relying instead on the slow diffusion of nutrients from synovial fluid. Since cartilage cells or chondrocytes repair damage very slowly and often cannot fully regenerate the tissue, injuries are more likely if stress increases too quickly. This lack of blood flow makes cartilage particularly vulnerable when people start exercises without proper preparation or following a program that drastically increases loads week by week. To prevent sternum pain, adjust the technique early on by keeping a few key points in mind. Change the position of your thorax. Maintain a more closed dip position with the shoulders protracted and depressed through the movement. This positioning enhances the stability of the shoulder blades, reducing the likelihood of excessive force being transmitted onto passive structures. Consistently holding the stable position during each repetition is crucial, as elevated shoulders can compromise stability and control, increasing the risk of strain or injury. This solution is a good idea if the athlete experiences pain when dipping too openly. Some athletes dip very closed and experience pain that could be due to the extremely compressed position of the thorax during the closed dip. An excessively closed position could lead to excessive strain on the sternum, just the same as being too open. This is why understanding why you're feeling this pain and acting accordingly is very important. Avoid going too deep. While the depth of the dip can vary depending on your personal goals, avoiding excessive depth is critical if you're experiencing pain. Overstretching the chest, particularly in a very open dip position, is not recommended until the pain subsides and the sternum is healed. For now, aim to lower yourself to about a 90-degree bend in the elbows or slightly below to minimize unnecessary stretching and reduce strain. Rest and deload. Taking a break from dips and other exercises that stress the sternum is essential for recovery. Cartilage, the tissue affected in conditions like costochondritis, heals slowly because it has limited blood supply. Continuing to overload the affected area can delay or even prevent healing, as the repeated stress aggravates inflammation and may worsen the injury. Therapy. Mobilize the thoracic spine. The thoracic spine plays a pivotal role in upper body movements, and restrictions in its mobility can contribute to compensatory stress on the sternum and chest. Improving T-spine mobility can reduce the strain on the passive structures of the chest and promote better movement mechanics. The T-spine primarily allows for flexion, extension, and rotation, which are key targets for mobility exercises. Here some suggested T-spine mobilization exercises. Foam roller extensions. Lie on your back with a foam roller placed horizontally under the mid-back. Support your head with your hands, keeping your elbows pointed up. Slowly extend your upper back over the foam roller, focusing on creating gentle flexion and extension. Perform 10 to 12 slow repetitions. Cat-cow stretch. Begin on all fours with hands under the shoulders and knees under the hips. On an inhale, arch your back, cow, lifting the chest and tailbone upward. On an exhale, round your back, cat, tucking the chin and drawing the belly button towards the spine. Repeat for 10 to 15 smooth repetitions. Thread the needle. Start on all fours and thread one arm underneath the other, rotating the T-spine as you reach through. Hold briefly at the end range, then return to the starting position. Perform 8 to 10 reps per side. These exercises help alleviate stiffness in the thoracic spine, improve posture, and reduce compensatory stress on the sternum. Address the pecs with light stretches and soft tissue work. The pectoral muscles can exert excessive strain on the sternum by pulling on the ribcage, potentially worsening the injury. While mobility exercises are often the first choice, individuals whose injuries are due to significant overloading may struggle with high tension in the pectoral muscles. To alleviate this tension, gentle stretching and soft tissue techniques can be effective, provided they cause little to no pain. Any stretch targeting the pectorals can help, but some may place the shoulders in less than ideal positions. Classic option such as the door frame stretch works well. But here are a few alternative suggestions to explore. Exercises for the pectorals. Gentle mobilizing. Chest circles. Perform the biggest possible circle. Try not to lift your hand off the floor. Pause where it's tight. Prone pec stretch. Adjust intensity with your leg. Perform for short intervals in the beginning. Stronger stretches. PVP pipe stretch or dumbbell weighted stretch. German sit. Grabbing something behind back. Rings, T-Rex, stall bars, and elevating the chest. Machines like the pec deck or cable flies can be a great tool to slowly begin loading the previously injured structures again. Progress slowly. Make sure to work with controlled tempo and add range of motion step by step. Here is an example of how a rehab plan could look like.
Now we are going to apply what we have just learned by structuring an exercise program that will help you with sternum pain. We will just throw all the exercises we've just seen into a program, add some sets and reps, and just start there. It's really important to not overcomplicate things. Doing a rehab program by itself will already help you relieving the pain over time. So just start somewhere. There's no magic exercise by itself that will relieve the pain, so keep that in mind. Just start somewhere. And another important aspect is to not work into pain. Those exercises are designed to help you and they should not be painful. If you feel a mild discomfort in your sternum, that's completely fine, but this shouldn't exceed 2 or 3 out of 10 when it comes to pain. Another important aspect is to track your pain level over time. Those rehab programs, they will take up to 3 months depending on how severe the injury is. So your healing process can be very individual, can be a lot less than 3 months, can be more. Keep that in mind that you want to track your pain level over time. And also, if you are performing the rehab program for a longer time, let's say you're already doing this for 2 months, then you can start to add some more exercises. Before, I would not really suggest that. So just stick to the program. You're doing the right exercises and track your pain level. If after, let's say, 2 months it hasn't gone down by anything, then you can add some more exercises, increase the stimulus you're doing with the program. We are training to not have pain and not to be stronger and bigger. So of course you all should also adjust your training to not create too much extra stress. Let's go over the program. You start out with some cat-cows, do 3 sets of 10 by 15 reps, then you do some foam roller extensions, 3 sets, 5 to 8 repetitions. This doesn't need to be dogmatic. See what feels good that day. You should feel mobilized in your thoracic area. It's not like a strength program where you just add reps and sets all the time. Let's say you're in week 5 of the program doing all those exercises. You can maybe add a set of cat-cows or foam roller extensions, depending on which exercise feels best for you, has the best effect on feeling more mobilized than before. But only do that if you don't already feel anything changing. We continue the program by doing some thread the needle with a rotation at the top part, doing the pec lock, prone pec stretch, and foam rolling the chest muscle. I know there's a big debate out there whether or not foam rolling works or not, but it's the closest thing to a massage that you can do by yourself. It doesn't cost you a lot of time, and most people have either a foam roll or a small massage ball at home, so you can try that out, see if it feels good for you. Also note that this program is taking 20 minutes to 30 minutes at maximum. You can do that at least 2 or 3 times per week. And like I said, adding this to your regular workouts will already help you create a change, give you a different stimulus that will point your body in the right direction towards healing. Back to Dennis.
Thank you for your time. As always, if you enjoyed this series, let us know by subscribing and leaving a comment. In the next physio videos, we will cover proximal bicep pain given by dips, the very common rotator cuff injuries that happen with this exercise as well. Stay tuned.